Good morning, members, and welcome to our AAIP webinar. Actually, this is the second one.
You said good morning.
Oh my gosh, what time is it? 8 p.m. Excuse me. Good afternoon.
Oh, good evening.
This is actually our second webinar of the month. Our first one was last week, and those of you that did attend, it was our first webinar of this season, and it included the video. So we showed the video, and we will be sending out the disc on that. But
it may come a little bit later this month because we're still into final editing on that. So it may, usually we send out the videos this weekend, but we may have to drop them next week. We want to make sure that it's really complete and it's really the training package that we want. So give us a few extra days, but we'll get on it. Carrie's working on it right now, so we know it's going to be done in a few days.
The first webinars of each month will include these videos that we have made for you guys, and most of them are acted out videos to do a scenario for whatever it is that we're training. Next month we're going to start doing the new patient phone call, so it will be us and our staff answering live calls and handling the issues by acting out so that your staff can watch these and really get an idea of how they're handled. Instead of us saying how to do it, we're going to show you how to do it. So as we said before, we're really excited about these, and they'll make a nice training library for your practice. These second webinars that we're going to be doing, which we're doing tonight, is the treatment planning sessions, and these have been by far the favorites because for doctors, we're going over treatment planning. So it's how to plan a case with options, how to plan larger cases, how to, as Dr. Sheldon has said before, be the director of dentistry where you're planning everything and then referring it out or keeping it in or whatever you're doing, and then having your financial assistant close the case. And I will be doing the case closing, Dr. Sheldon will be doing the presentation, and together we'll show you every single month a different case on how we do that. So what do you have for us?
So let's go over a case, okay? So these are the things that happen. They happen to us every day. And by the way, this is something that happens to you every day too. So let me get the PowerPoint up. Let's get rid of the advertising and let's get some other stuff up here. So let's take a look at Jim. And this is the way it starts. Let me go to this particular point. All right, so it starts with an intake call. And so Jennifer picks up the call. Most of you have met Jennifer by now. And Jennifer took this call, and you can read it yourself. Referred by the internet, Google, had already seen a periodontist. So this is a periodontal second opinion. Not everybody who comes in here for full mouth reconstruction or whatever you think they come in here for. And even some dentists even still refer patients to us. So Jennifer's very blunt and takes down what's said on the call, and it's important that you record this so that I know what's going on, because you know what's going to happen next, the doctor phone call. And I want to paint a picture for you, and that is that this is a play. This is a movie. This is a performance. And the performance begins the moment the patient calls, and the performance continues to build until the patient has accepted treatment and until the patient actually has successful treatment done. And there are certain steps that we take in order to be able to do this. Omit a step and there will be fewer patients coming in. Omit a step and there will be less treatment acceptance. I don't care whether you're a referral practice or whether you're an independent practice. Omit a step and it will change. How do I know? You all know how I know. So, patient's wife reviewed, found out that I was a faculty member of the University of Florida. Okay, so that was what impressed her. We talk about the importance of public relations. That is one of the things that's public relations. Is that I'm still a professor. I haven't taught at UF for 5 years, but I'm still a professor there, and so we list that. And so that was the reason the person's coming in. Now, understand, this patient is driving from 60 miles away and probably passes at least 5 or 6 periodontists on the way. So that's the reason the person's coming in. Explain the $79 consultations and scheduled for me to call today. And we found out that it's very important that I make the call to the patient on the same day the patient calls in. And so we do everything we can to make sure that happens, except on weekends, of course, or late Fridays. We don't do that. So let's go to the next step here. And let me push the right buttons. Okay, so I call him and I talk with Jim, and he tells me he has 2 teeth that are broken, and he'd like to keep the teeth if he can. He was told by the other periodontist that he needed 5 teeth taken out. And I guarantee you in a moment, when you see the x-rays, you'll see why the periodontist said take 5 teeth out. As a matter of fact, you could make a case to take even more teeth out. Told us we just had x-rays taken a couple of days ago, and so I leave a note for Jennifer or for our front desk staff, because our front desk staff, we have other front desk staff that handles this. Please mail a release form to Jim so we can get the x-rays from Individual Dental. So essentially, I've had a conversation with Jim. It probably lasted 2, 3, or 4 minutes. He's impressed that I've even made a call to him. Already we've differentiated ourselves. And essentially, I'm there to listen and just to understand what's going on. And then I ask Jim if he has any question of us. And he will ask me whatever questions he asks. Okay, so now the patient comes in. Oh, I'm sorry. So the next step is, in this sequence of events in this play, is that the patient is going to receive a package of information from us. And those of you newer members will see that it's a folder with the 3 doctors. It's sent by priority mail. Important to send it by priority mail. Why? Because you are a priority. But more importantly, the patient is a priority, and priority mail is going to get open first. And priority mail, as most of you know, is fairly inexpensive anyway. Okay, a little piece of paper that says what differentiates us, a copy of our book, and a welcome to our practice DVD. So that's all coming out to the patient. The patient's going to receive that 2 or 3 days after the phone call is made. Okay, what's the next sequence of events? Now the patient comes in, and he will see Danielle. And Danielle, why don't you go over a little bit about what you would do, and I'll get up some other things if you'd like. Just tell me what you want.
Sure. I mean, of course, I introduce myself and get the patient seated. And my goal here is just to find out what he really wants. What is the problem? How is it affecting his life? And what really he would like to have done. We already have the x-rays and everything sent in from his other practice. I take some pictures. We take the CAT scan. Looking at the CAT scan, which we have, we can say, which of course I don't tell him what's going on, but I do want to kind of educate him a little bit on what I see, what a normal CAT scan or panoramic view here would show, and what's going on here. So basically, I would say, okay, this is the view here, Jim, that you have of your mouth. As you can see, the bone levels normally should be, at this point here. And you can see this black area is bone loss. The gray fuzzy area here is bone. And you can see where your bone levels have dropped. You've lost bone, and especially in those areas in between the roots of the teeth. So I can see, why the other dentist was concerned. I can see, where that's coming from, because this is not normal bone levels. So I'm finding out what his symptoms are. So what do you experience? Are you experiencing bad breath? Are you experiencing mobile teeth? Are you experiencing any bad taste? Even though he may not have these, I do want him to know that all these are associated with periodontal disease. And so if he has not yet had these symptoms, these are symptoms that he could start to begin to have.
But Jim feels fine, or I'll play Jim. I'm fine.
Yes.
Everything's okay. I broke off this tooth over here. I broke off this tooth over here. Number 19 has a lingual crest broken. That's my main concern. I haven't seen a dentist in 10 years. And by the way, I was just in the hospital a year and a half ago for lung cancer, and that was successfully treated by chemotherapy. So now I'm ready to start living again.
Got it. So what is your purpose for coming here today? What would you like us to do for you?
Well, I don't like the idea that this tooth is broken, and I know that needs to be fixed. I just need to know what needs to be fixed. I'm concerned the other periodontist told me that I'm going to lose some other teeth, so certainly I want an opinion on that as well. But really, I'm feeling fine. The teeth feel firm to me. Everything's okay. And I broke this tooth a long time ago. It doesn't really bother me, but I broke it. And, I know it's broken, and nobody can see it, but I can feel it with my tongue.
Right. I understand that. I get that. And we have had many, many, many of patients come here just like you from down the street and across the West Coast. We've had many patients come in with the same concern that they've gone to see a dentist, a specialist, somebody, and they have told them all the teeth need to come out, and they continue to look for the hope that there's something else that can be done. And we have told patients, just like you, that, we can save your teeth, and I'll tell you right now, if Dr. Sheldon feels like he can save your teeth, most likely he can save your teeth because he wants successful cases. He doesn't want to try to, be brave and try to do something nobody else can. He can save teeth. So we had a patient not too long ago that I can remember that drove all the way 3 hours here, a 6 hour trip, 3 hours here, 3 hours back for every single one of his visits for cleanings because we did, using our perioscope, was able to take care of his periodontal disease and keep him under control, and it was worth the trip for him.
Yeah,
So,
and there was a lot of diagnosis, and he was told by several people he needed to have the teeth taken out. I'm not bragging here, but understand, remember, we're differentiating ourselves, and we're differentiating ourselves as periodontists. We do an awful lot of dental implants. We really do. But part of being open to doing dental implants is being open to saving teeth. And those of you who read AAP Connect, and I'm not talking about my comments in AAP Connect, but others, understand that we can save teeth, and that's really how we can and should look at a patient first. So Danielle gets done and really has spent a half an hour doing the blood pressure, talking with the patient, taking the x-rays, taking the CT scan, because, by the way, I'd already told her in advance that's what I want done. And so now Danielle comes back into my little desk, where I'm talking from right now, by the way. We're sitting right at my desk.
right, right.
And so what do you tell me?
I tell you that patient James is in room 1 with his wife. That here are the notes from his new patient phone call. Here is his notes from when you spoke to him on the phone. Basically, they did get news from a dentist in Vero Beach, which is an hour away, that they would have to take out all of his teeth and give him dentures. And they Googled for some help and found your name, went to your website, and they were very impressed with the website. They ordered the book. They were impressed by the book. They were impressed that you were on the faculty of UF, and he's very excited and hopes that you can do something for him. No complaints. He just wants to save his teeth. He doesn't want his teeth taken out.
Now, I understand, and good. And so then I go into the operatory and understand that the excitement is built up through the little touches that have occurred. Okay, I am going to belabor the point because we want to follow a pattern here. And that is, intake call is made, patient is acknowledged, concerns are understood, notes are made, those notes are transferred to me, I make the phone call to the patient, I make notes on the phone call, transfer them to who the examining assistant is going to be, or front desk if I need additional data. Now the person who's got the additional data orders the x-rays or gets the x-rays from the other dentist, and those notes are already there. So when Danielle greets the patient for the first time, Danielle already knows the 2 touches that have been made and what's occurred there. Now Danielle continues the interview. Notes are made there. She briefs me, and now finally I come in. Notice all the things that are done. But by doing all of those things, I don't have to spend very much time with the chair, because the patient already knows that the staff is taking care of the patient in a way the staff never has before. So here you go. You've read the medical history, because while I'm blabbing, you are reading. So let's take a look at pocket depths. Okay, so we look at pocket probing, and you'll take a look at that, and you'll say, all right, I can see there may be some cause for concern there. Now we'll go across all the way here. You'll see the pocket depths, and those are represented here well. But there's one thing that will be very interesting, and that is that there's a class 2 mobility on tooth number 18. Tooth number 18 is the only tooth that's loose, and it doesn't bother him. He doesn't even know that it's loose. Let's go further on that, and let's take a look at some of the x-rays. So let's take a look at the FMX. Okay, we'll go through it. I'm sure, let me darken this down a little bit, but I'm sure you can envision that perhaps there's a frication in there. Obviously, this is a tooth that many of us would choose not to restore, and I probably would choose not to restore it as well. And we just go across. And let's look at the good here. And there's lots of good here. Certainly there's plenty of bone support on the upper anterior teeth. Yes, he's lost some support, but 65 years old. I used to think that was old. And doing well. I'll take a look at this tooth right here. That's pretty fishy, isn't it? Let's darken that up. Let's see it, okay? So that's a pretty fishy tooth. Doesn't bother him. Doesn't hurt. There's another view of it. Okay, let's look at tooth number 18. Tooth number 18 is loose. Okay? There is some bone someplace. You can argue as to how well it's attached. But we've got calculus in the frication here, and certainly some evidence of calculus there as well. And I'm not saying the calculus is causing the bone loss. I'm just giving observations. Number 19, that has a lingual cusp that's fractured. That's why you're seeing this here. And there's some frication involvement, but again, there is good bone support in the areas that are around the frication, so or above the frication. We go to the anterior teeth, and those have quite a bit of bone loss, as you'll all notice. Okay, and you can envision the calculus that's there, and you can take a look at the teeth in the posterior right side. Not much better than those in the posterior left. Certainly, class 3 frication involvement is pretty apparent there. And we note that during the clinical examination as well. Let's go to the CT scan and see what we see here. Okay, and so when we look at the CT scan, and I will enlarge some of the views here. Why do we have to take a CT scan for periodontal disease? I'll show you. We can start to see the relationships of each of the roots, and we can see where roots are supported. I'm going back and forth on tooth number 3 right now. And there is some reasonable bone support on the roots, despite the presence of this huge frication, this huge class 3 frication here. We look at tooth number 4, and frankly, there is still some bone support for tooth number 4. Whether we would choose to do crown lengthening, endo, and a crown, I think we could argue that point. I would choose not to, and this would be one place where a dental implant would certainly be indicated, in my opinion. Okay, we go to number 5. Again, good bone support. We're going to go through number 6, 7, 8, 9, 10, 11, 12, 13, and now we're number 14. And by the way, I'm going through this with the patient after I've done the examination. And I'm saying, I'm really concerned about tooth number 14. I'm not sure that's going to make it. And that's probably one of the teeth that the other periodontists recommend be extracted. I want to show you what our risks are here. And the risk is very simple. Here is the tooth. The bone should look like this. If you see anything that's dark here, that's not bone. That's infection. And that infection is coming very, very close to the sinus. It hasn't hit the sinus yet, but it's coming very, very close to the sinus. I'm concerned about this from a health perspective, not from a dental perspective. There have been times when I've seen patients keep teeth too long. And when they kept teeth too long, then this bone, you see this little area of thin bone right here? This area of thin bone went away. The patient then wore a hole in the sinus, let me tell you. Filling or repairing a hole in the sinus is no fun. It's no fun for me. It's no fun for the patient. So I'm painting that picture as the patient is looking at the CT scan with me. We go to the next step and take a look at this. We've got a frication here, and take a look at how thin the bone here is as well. So I'm concerned about this one from a health perspective as well, although the bone support is better. Let's go to the lower. And I already know by this time that how can I do this with this thing in the way? It's the first time I've had a don't know what to do with it. Okay. I won't go through this. I want to go through the CT scan the lower. I can't grab the handle to get it down because the GoToWebinar icon is in the way. I'll have to learn what to do in that particular case. But anyway, we'll go through this, and you see class 3 frication. This tooth number 18, is mobile. Tooth number 19 is not. Tooth number 19 has lost its lingual cusp. And I'm going to show you something about tooth numbers 18 and 19 in a minute. Okay, 20, 21, 22. Everything you see on the CT scan, frankly, is easily duplicated on the PAs. Let's go back, and I want to show you some photographs now.
Do you have on in vivo?
Yeah, I'm going to do the in vivo in a second, but I want to bring up the photographs first. So let's take a look here. I'm going to select some a photograph right here. Okay, and what I did was to pass shim stock on between number 14 and number 19. And because of the broken lingual cusp, and because of the way number 14 was restored, number 14 and 19 are barely in contact. But number 15 and 18 are solidly in contact. So the tooth that has that, so the teeth should be sharing the load, and certainly the first molar should be taking more of the load. In this case, the second molars are taking more of the load. And take a look at this. That's a working site interference right there. And so now we know the reason for the mobility. It is not just the fact that the tooth has periodontitis, not just the fact that there's severe bone loss, but also there's a problem with occlusal contact here. And don't forget, it's asymptomatic, but it's a class 2 mobility, and then I ask the patient to put his fingers on that tooth and wiggle it, and he can. So now he has a greater understanding of what the problem is. Let's paint the picture a little bit better and a little bit differently, and let's take a look at it using the Anatomage software. You see, patients can't see x-rays very well, but they can see this real well. This looks like something. They're impressed with this. But if we push this function, they can see it even better. And let me just improve that. Well, that's not improving that very well. Hang on for a second. Let's look at that a little bit better. You want to explain bone loss to a patient? Let them look at this. Let them look at this. Let them look at this. The area where the bone was lost, and it's very, very close to the sinus. And now the patient has a true understanding of what's going on. Now, I'm not saying take a CT scan for everything. I don't. If I think I just need a full-on series of x-rays, I will. But there are times when the CT scan is both more diagnostic for me and certainly gives the patient a greater understanding. And frankly, we want the patient to have a greater understanding. The Anatomage software used to cost, I don't know what it costs now, but when I bought it, it was $5,000, and we got, I think, 25 free surgical guides with it, something like that at that time, so it really cost me nothing. All right, so let's assume you don't get free surgical guides, but you get a chance to show a patient this. And how much of a difference can that make? How much of a difference does it make to you, Danielle, when you're talking with the patient?
Difference for me explaining it to the patient?
Yeah.
I don't do a whole lot of explaining on this. All I have to do is pull it up to load it for you, and they're like, oh my goodness, that is incredible. I've never seen that. So as I'm loading it for you, so when you come into the room, I do move that around a bit, and then I start to point out like the bone loss, just minor things, so they can get an idea of what you're looking at, and they are blown away.
Okay. So now I'm talking with the patient, and essentially I'm saying, Jim, yeah, you do have severe periodontitis, and I do understand why the periodontist that you saw said to extract several teeth. Extract 5 teeth. I can see the reason for extraction of 5 teeth, maybe even more. But you're not symptomatic. And by the way, I do see a problem where you're hitting the back tooth on the lower left side too hard. Now, I don't know if I can save that tooth at all, but I do know this. There's a lot of infection in that tooth. There's heavy calculus, and calculus is hard bacteria that's on the root surface. I can see that, and I also can see that that tooth is meeting much harder than the other teeth. So I want to do a bite adjustment. As a matter of fact, I want to take it out of occlusion, meaning I don't want you to be biting on that tooth while it's healing. Just as if you had a broken arm and we want to immobilize your broken arm and even put it in a cast, here I don't want you to be able to chew on that tooth while we're treating the infection in that tooth. Now, this tooth right up here tooth number 14, which we can all see here, I think we may lose that. But right now, I'd actually like that in place because I'd want that to take some of the force that is now being derived or now being taken by number 18. In other words, I can't get 18 to heal as well if it's in function, and I can get these two teeth to work together and take this out of function and see if we can get this to heal. And who knows? We may get improvement in tooth number 14 as well. I don't think we will, but it's not going to cost anything more to try, so let's try. Now, understand, I'm very big on the periscope. I'm talking to you now, doctors. I'm very big on the periscope, and I think the periscope is almost essential, and certainly it's essential in my practice. But if you use laser, or if you use scaling and root planing, you can give the patient the same approach that we're using the periscope. And what the patient wants to hear is that we're taking every step to control the infection, because after all, you've got infection through your entire mouth. We're going to make take up every opportunity to control the infection and see how we do. I just want to make sure, Jim, now I'm talking to Jim, that you're open to this, that in fact you understand that we're going to take a period of time to treat, and then we're going to take a period of time to reassess, and you and I are going to be getting together again and talk about this again. And we'll see how we've done. In the areas where we've done well, that's great, and I think we're going to do well in most of the teeth. But in some areas we may not do so well. I just want you to be prepared that we might have to extract, particularly if there's sinus involvement, and we don't want to jeopardize your sinus. At that point, he has a full understanding of what's going on. And so then I tell Danielle, here's what I want to do. And I tell Jim, I'm going to speak in dental language now. Here's what I want. I want an occlusal adjustment to number 18. Please take number 18 out of occlusion. Okay, we're going to do that at the same time as we do an EAPT 6. The other thing I want, because I don't think we can save number 4, is let's extract number 4. If I can, we'll put an implant in the same day. We'll do a bone graft around the implant. I'll need PRGF and Mineros. And then later on, we'll do a custom abutment and crown to number 4. And then we'll see Jim for reevaluation, and we'll decide how we've done on everything, and then we'll get back together again. Any questions you have for me before you and Jim talk?
Yes, I do. So you want EAPT program for Jim. You don't. This is not just regular root planing.
No, I want to make sure we're using the camera. We want to make sure we get every bit of that calculus that we see. I want every opportunity to get this out non-surgically.
Okay. And what are other areas that you want him to concentrate? What can Jim do to help us with this?
Well, first of all, we already know that Jim has a health problem, and so I'm interested in a couple of things. Number one, is this where you want? You don't want this?
Next one.
You want
EAPT.
this one? Oh, you want this one? Okay. So there's a nutritional component to periodontal disease, and I'd like you and Jim to review that. Now, Jim may want to see Lisa for nutritional counseling because, Jim has health issues as well, and health issues are also reflected in the mouth, and the disease is pretty bad. Now, I've got to tell you, in Jim's case, Jim did see a nutritionist from the cancer center that he was using, gave him lifetime nutritional counseling. And so there was no reason for him to see Lisa. But in our office, we'd encourage somebody that has severe disease to see Lisa, who's a certified health coach, to be able to coach him through. And you'll see me talk about that. Those of you going to the AP in September will talk about that. But still, there are nutritional supplements that help. And there are certain things that we use. Patients on Lipitor on a statin drug take coenzyme Q10, vitamin D, Juice Plus, which is a nutritional supplement which has 31 studies in the literature. I'm talking about peer-reviewed literature that shows improvement on a cellular level. And so there are certain implements that we use that are going to help a patient. And frankly, I've got a video that tells the patient about this. So while Danielle is adding up how much it's going to cost, the patient is watching this video that lasts for, what, 7-10 minutes, something like that?
Yes.
Yeah.
All right, so I'm gonna put them on for the EAPT.
EAPT, for everybody, that means endoscopically assisted periodontal therapy. Okay, it's perioscopy. John Kwan would call it perioscopy. We call it EAPT. It's the acronym that we use.
Okay, and as of right now, there's only one tooth that we have to extract for Jim, correct?
That's right.
Good, great. All right, well, I have everything that I need to explain this to Jim. Jim, did you have any other questions for Dr. Sheldon before he leaves?
Nope. And what Jim said to me was he was already impressed before he got here. You know, which is what we want. We don't want to force people in here. We want people to be drawn, magnetically drawn in here. And most of us are used to getting that magnetic referral from the general dentist. So the patient is already pre-screened and is already ready. What I want to show you is that you can do the same thing with the correct PR, marketing, and communication skills and get a patient who's also ready to have treatment done.
So what I would do at this point is in the operatory which we're in, we do have computers and large TV screens that we're showing x-rays and CAT scans on, pictures for the patient. I'll go on ahead and show that EAPT video that Dr. Sheldon has made. It's just a simple little YouTube video that he's created. And like he said, it's about 7 minutes long, but it's long enough for me to go back and put this into the computer and work it up without Jim watching me do it. He can watch his video. The video is just Dr. Sheldon talking. And if you want this video, we can email this video to you just to give you an idea of how you can do your own video. But basically, it's Dr. Sheldon explaining the disease, explaining that it's not just brushing your teeth or the lack of, that it has to do with internal nutrition, it has to do with lifestyle change, that it's just like any other degenerative disease like heart disease, diabetes. It's something that they are prone to, and they have a lot of control themselves on preventing this from coming back. We can take it away initially with the root planing, but in order for it to not come back and create the same problems, they have some work on their part to do. So he's watching this video. I go work this up. I'm putting it in a professional type of document that shows what we're going to be doing, prices, consent forms, so on and so on. This picture that you see on the screen, we actually have in a folder packet basically explaining all that the EAPT is including, because it's not a product or a treatment, it's a program. And so I'm going to go in there and explain this program to Jim so he doesn't think that he's paying this money for a single visit. He's paying this money for a program that we're going to help him get through. So Jim watches the video. I then take him back to the consultation room. We sit down and I say, Jim, how'd you like that video? Oh, it was the response. Usually it was very informative. I really got something out of that. I really understand what's going on. Great. Do you have any questions? Usually, no, not really. Don't have any questions. And then I start to explain again by reiterating basically what had happened. So Dr. Sheldon, I'll have you play the patient. Basically, I'm going to do all the talking, but you play the patient.
I'm used to that.
And really what I say to him is, Jim, you knew coming in here this is a pretty serious disease that's going on here. You still may, and as Dr. Sheldon did explain, you still may in the future lose a few more teeth. 14 and 18 was on his list of things to watch. But again, as I explained early on, there's a chance that you won't lose anything at all. But going into this, we want you to understand that there's a possibility. It's been a long time since you've been in the dental chair. There's a lot of things that are out right now. And we feel like by implementing some of this stuff in our program that we can very well save these teeth. So are you okay with trying this?
Yeah, I'm ready to start. Actually, I was quite impressed with everything that's occurred in the office. So, yeah, I do want to save my teeth. I understand that I'm going to have to lose that one.
Good.
And I'm fully on board.
Great, great. Well, the way we do root planning essentially in our office is a little different. We've actually created it into a program. So we're going to We're going to be helping you to get through this because, just as the video may have explained, this is a disease that you have that you're prone to, like heart disease or diabetes, and you are prone to it. So just like somebody with diabetes cannot eat and do things as a person who doesn't have diabetes, you're just going to have to do a little bit more on your part to prevent this disease from returning. Really, there's no real cure for periodontal disease, but you can keep it under control. We can help you keep it under control. So as you see here on this paper, which we should have probably included on here, the first thing on here goes over EAPT. Now, EAPT can be 1 all the way to 6, and the number just determines the amount of time, the amount of hours that you're going to be having the root planing procedure using the endoscopic camera, which is the perioscope. It works a lot like an endoscopic camera, like having an endoscopy, with your throat. We can go down through the roots, and we can see what's down there. We can see what's going on and effectively remove it. So it's an essential tool for this to make sure that we are removing all the calculus debris and the things down there that's causing this. So we're going to do that about 6 hours, and as you can see listed below, and in this folder here, which is included in the EAPT, with this program includes these supplements that we're going to be going over on how to use them. It's going to be going over all these tools that we're going to show you how to use to implement better oral hygiene at home. Like I said before, you have to do a little bit more than the average person. We're not saying that you can't brush your teeth or don't brush your teeth, but what we're saying is you're going to have to do a lot more than the average person because you're fighting a disease here. And we're also going to go over diet. We're going to go over what you take in on a daily basis to make sure that you're fueling your body correctly to keep this disease away. Next on this sheet, you'll see that we are going to be doing an occlusal adjustment on 18, and as Dr. Sheldon had explained, this tooth is very mobile. It's hitting very heavy with the tooth on the top, so we're going to take that out of occlusion because if you don't beat it up, odds are you will be able to keep it. The next thing is we're going to do impressions for a space maintainer for number 4 because that's the only tooth right now that Dr. Sheldon feels like has to go. So we're going to remove that tooth and we're going to put in a nice healthy implant in that area. And after that area heals, we're going to put an abutment and crown there for you. So as you see this whole plan together, you are going to become seeing us quite a bit. We're going to become very close, and we're going to help you get through all of this. And once all this is clear, and I think he said within a few months, we'll come back and we'll reevaluate everything. And you're going to be coming back here and seeing us for cleanings indefinitely. So I'll be keeping an eye on you to make sure everything stays under control. So the first thing I want to do for you, Jim, is I want to find out what your schedule is, what works out for you. The very first thing here is that root planing, the EAPT with the dental view camera. It's 6 hours. I can divide that into 3 hours a piece to do half and half. So if you give me a day that works out better for you, it's a long time. It's 3 hours. So give me a day that would work better that you can spend 3 hours with us.
Actually, I'm retired, so I want the first opening. I want to get this under control.
Well, that makes it easier. We are scheduled out for that, but let me get with Jennifer on that. I'll give her the time we have for 3 hours. And like I said, that'll be 2 different appointments because 3 hours is a long time to sit in the chair, so we don't want to make it too painful for you. So we will split it up into 2 separate appointments. Now for that, you are going to be numb for the entire procedure, so you won't feel a thing. And afterwards, we'll go over the aftercare instructions once we get all this paperwork out of the way. The next thing is going to be for your surgery. So same thing for your surgery. I'm going to schedule you to come in to have number 4 extracted on a different date and have that implant put in. So any date okay with you on that?
Yep. I'm fine.
And as with all this, you can drive yourself here, drive yourself home, unless you wanted some type of sedation, which I don't really recommend it. It's just a comfort option. Are you okay with driving yourself and driving here and home?
Yeah, I'm fine.
Perfect. All right, so here was what I have. I have this date here for you to come back for the first 3 hours of your EAPT program. And then this date here is going to be for your very first oral hygiene instruction, and that's where we're going to go over all these products and all the supplements and the diet regimen and so on and so on. We're going to go over that educational portion with you here. The next appointment I have here is for your next 3-hour appointment. The next appointment you see here is going to be for another oral hygiene instruction, and we're going to see how you're doing and see if you have any questions and make sure everything is going well, that you don't have any problems. Next appointment that you see is one more of those oral hygiene instructions. And after this point, really, most patients got it. They know what to do. They understand. But as we tell all of our patients, if you feel like you need more, then we'll schedule more. We'd love to help you with that.
All right, that's good.
And then we're going to move on to the surgical portion, which is going to be the extraction here in the implant. It's going to be on this date here. And like I said, we're going to go over the pre and post op for that because I have a nice little basket I'm going to give you in addition to this. I tell you what, you're going home with a lot of products today, but the basket is just to prepare you for the surgery, because after the surgery, we're going to ask you to go 24 hours cold soft diet, not eating on that side, and some things that you could do just to make sure everything is comfortable and goes well for you. So here's all your appointments. Then we'll go over the consents, consent here, consent here. Then I present the financial. So Jim, here is everything that we had mentioned. Here's all your appointments. Here's everything all summed up here. The total for this is going to be $9,807. There's a few different ways you can pay this. First way you can pay this is we do offer care credit, 12 months interest free. That allows you to go 12 months with payments to pay this off. Like I said, no interest whatsoever. So a lot of patients do like this because it's kind of like borrowing free money to make payments, so you don't have to come up with it all at once. The second option that you have here is we do offer a prepayment discount. If you're ready to go on ahead and pay for this, you can prepay for it today, and I can give you a 5% discount off of that, which is a pretty good amount of savings on there, and that will give you that option. And then the last option is you can put a down payment today to secure these appointments, and then 2 weeks before your first appointment, you pay the balance in full, and that gives you a few weeks to organize that. So which one of these gems works out better for you?
I think I'll take the prepayment discount.
As with most patients do, it's free money. Why not take it? All right, so do you want to do that with check or credit card? How can I do that for you today?
I've got a credit card. I can give it to you right now.
Perfect. All right, so I'll take that for you. Let me get these copies for you. Let me get that basket for you. I'll run this card, Jim, and I'll be right back. Come back. Here's your copies. Here's your receipt. Here's all your appointments. Jim, it was very nice working with you today. Or is there anything else that I can do for you today?
No, I came and I got what I wanted. It's worth the 60-mile drive for me to come up here.
That's great. It's so nice working with you. And like I said, you're going to spend some time here with us, and we do look forward to it. We love making this change with patients and seeing the difference it can make. And, of course, we always love giving the good news that we can save you all these teeth and work with you on this. So thank you for everything. If you have any questions, my name is Danielle. Here's the phone number here. Give me a call and let me know if there's anything I can do for you.
Well, thanks, Danielle. It was great meeting you.
All right.
So that's the idea. Essentially, notice what Danielle was doing. Was Danielle giving any options? Yes, she was giving options as to whether you can schedule on a Monday or Tuesday or something along that line. Essentially, Danielle was bringing the patient all the way through with positive, good control, allowing the patient to know that, number one, we care about the patient, and number two, that there is something that can be done and we're going to do it. And we've been very successful doing it. Jim already understood all of the other precautions because I explained them to him as well. And so essentially the patient is led through, and this is the way it goes. Are there going to be some patients who are going to say, well, I can't afford that? Of course there are. But then it's a matter of coming up with how care credit can help the patient, or working with systems with credit cards. You know, I could have made it a lot more difficult, but I want to give you the idea as to what could and does ordinarily occur in our practice on what is a $9,000 or $10,000 bill for periodontal treatment, one implant, and of course we're doing the abutment and crown. And this is the same thing you could do as well. When you're treatment planning the implant, I want you to treatment plan the abutment and crown, whether you're doing it or not. You want the patient to have the complete information so the patient understands from you exactly what's going to be done. From start to finish. No, I'm going to go to the general dentist and we'll find out what the general dentist has to say. No, all of that's done through you with prior agreements from the general dentist saying, I'm going to present your fee too. And that way the patient has flowed through this examination using roughly a half an hour of my time and perhaps an additional hour or maybe an hour and a half of Danielle's time if it's more complex. And the patient has gone through the examination process, the treatment planning process, knows everything that needs to be done, that's the time the patient accepts treatment. And so the treatment acceptance occurs on the day of examination, unless there are extraordinary circumstances going on. Okay?
I will tell you though, when you don't get acceptance, and I've been doing this for a long time with you, and I've gone through many changes on how to make this very successful with you, you don't get acceptance when the patient doesn't understand. If they don't understand what's going on and why, they don't accept treatment. And what we have done, and Jim was a great example of this because he was really sold before you even gave him a plan. I think if you even would have said you're taking out all of his teeth, he would have stopped with you. He was very impressed with you because it's the building blocks to get there.
Yeah.
And if you can have that patient won over before the treatment is presented to the patient, you don't have to worry about them giving you a hard time about the money or the insurance and that sort of thing, because it doesn't exist. They don't care about how much it costs. They don't care that insurance is not going to cover it. They don't care about these things because they just want you to do it. So it starts with that new patient phone call, which we're going to do that video next month. It goes along with the doctor phone call. That's this guy, as well as other guys. They're so impressed that you took the time to call them after hours at home. You asked them questions. You were interested in what was going on. That you took that time. That's quality, and no one's ever done that before. Then when they come in, the way we treat them when they walk in, the way the assistant treats them in the room, the way we care, and the way we're sharing stories with them. It's not a standard structure. It's not something that's robotic. It feels very custom to them, and we make a point to do that so that when it does come time to us sitting down and presenting, I want the patient handing me the credit card before I even show them how much it is.
Good. Any questions, any concerns, any comments from doctors and staff who are on the webinar tonight? Just raise your hand. You've got that little hand-raising thing, and I will be able to see it if you do. Or if you want to type something into the chat line, we've received no chats today, which is, I think that may be good. Who knows? But if there are questions that came up or some objections, certainly you could all argue with my treatment plan, and I'm fully aware of that. I've given you the treatment plan that I offered, and some of you may be more aggressive, some of you may not. But at least it gives you an idea as to how we would take a case like this when a patient's coming for a second opinion. And let me tell you something. When a patient comes for a second opinion, they don't want to hear a reiteration of the first opinion. They don't. Now, if that's all you can give, you know, if the patient has class 4 mobilities on all the teeth and the first periodontist said all your teeth need to come out, I don't want you to tell the patient that all the teeth can be kept unless you really think they can. You know, if there's something you can do, by all means do that. But the patient is looking for a second opinion, another way out. And if we give the patient an opportunity to express him or herself, and we show the patient where we have some doubts, then the patient at least has gotten that second opinion, has a little bit of better understanding. Perhaps you take some more time, or you explain things in a different way, whatever that is, and then the patient will accept treatment.
Good.
Anything else?
No, our next webinar is going to be on August 3rd, and that's going to be the next video, which is an acted out video on how to answer the phone, and we have a lot of different scenarios to cover with that.
Much, yeah. We this time we're doing challenging situations, yes. So that we're going through the sequence, but you also see how we handle challenges that you all hear every day. So that's it for this webinar. Thanks for being a member of the AIP. Recommend us to your periodontal colleagues. There's a little bit of a bonus in it for you, but that's not the reason we're doing this. We're doing this in order to be able to help periodontists nationwide do better in their practices, be able to succeed and succeed as well as they possibly can. Thanks for joining us. See you next month.